Okay, it's recording. All right, so we welcome everybody to today's educational series. We are so glad you're joining us. And I know we have someone as far away as Fort Worth. So welcome, representative from Fort Worth, and anyone else that might be joining us from anywhere in the world. You are in for a treat today in case you have not met or ever heard anything from Dr. Mike. I assure you today will be helpful, it will be fun, and it will be really interesting. So I'm going to go ahead and introduce Dr. Mike to you guys in case you haven't read or heard. Dr. Mike is a physical therapist who owns and operates Tribe Wellness, a company that specializes in Parkinson's disease and other movement disorders. He received his doctorate in physical therapy from UT Southwestern Medical Center, and he is a 2020 graduate of the International Parkinson and Movement Disorders Society leadership program for the Pan American region, and he leads research studies in partnership with the Parkinson Foundation, serves on the Medical Advisory Board for DAPS, Dallas Area Parkinsonism Society, and holds an elected office in the Texas Physical Therapy Association. He has also been regularly featured speaker for the Davis Finney Foundation. Dr. Mike is a former amateur fighter, a black belt, black sash martial artist, and a fitness nut who seeks new ways to engage patients in fighting for their own function and well-being. Thank you, Dr. Mike, for being here and for enlightening us all. So I'm going to turn it over to you.
Well, thanks for having me. I'm excited about this topic because this is my world. This is my life, physical therapy and exercise. And I'm excited to talk about this for a few reasons, one of which is, as many of you know, there's probably nothing on the planet that's more helpful for people with Parkinson's disease than exercise. And in physical therapy, a lot of people do exercise. And yet, the two concepts are very different. And in my opinion, as well as that of many other professionals in the healthcare field, if you are a person with Parkinson's disease, or you know someone with Parkinson's disease, or really any other movement disorder for that matter, you should be doing both. Not just one, but you should be doing both. And if you take nothing else away from our time today, my hope is that you'll know when we're finished with all of this, that the two are different. You could say in a really general manner that exercise is helpful for slowing the progression of symptoms of Parkinson's disease and keeping the rest of your body healthy so you can live well and age well despite Parkinson's disease. You could say that physical therapy is a much more individualized method of treating a variety of impairments. So when you think exercise, think more general for groups or individuals based on general principles of keeping the overall body healthy and trying to be more preventative. And then you might think about physical therapy, especially as it relates to those with Parkinson's disease, as a way to get more of an individualized tune-up to better participate in exercise. So the two are really different, and there are a lot of nuances and what if and scenarios where there might be some variations to what I've just said, but I think that's a key theme that I wish I knew many years ago. I say that because long before becoming a physical therapist, I had the fortune and pleasure of teaching a lot of group exercise classes. And if I had known then what I know now, I probably would have been much more effective. And if not that, I also would have avoided some situations or gotten people in touch with folks who could have better helped them had I known a little bit more about what's available in physical therapy. We'll get into that, but that's my hope. You'll think PT, oh, physical therapy is an individualized thing that's part of the healthcare system. Exercise, big deal, needs to happen. Hopefully it's specialized for people with Parkinson's disease, but even if it's not, if you're safe, that's still good. I've done a lot of talks about exercise in the past. This is really just the bio that Leisha read, so I'm going to skip right on past that. When we think about our objectives for the day, hopefully, I'm going to really overemphasize this first one. It's important that if you're somebody with Parkinson's disease, that you exercise. I say that. Every neurologist on the planet says that. Every movement disorder specialist says that. And still, I meet patients in physical therapy or participants in group exercise programs who say, I heard it all the time, but I didn't realize just how important it is for me to be physically active because I feel so much better now that I'm working out. So that's a big deal. Also, we're going to dig a little bit into what a PT is. Where do you see physical therapists? Where do they practice? We're going to try to compare some of the differences between PT and exercise. And overall, I'm hopeful you'll get a little bit better of a sense of how the two are different, when to see a PT, and what goes into a good exercise program for people with Parkinson's disease. I've done other talks in the past for DAPS, as well as for other organizations on the role of exercise in treating impairments with Parkinson's disease. And a lot of those can be found out on the internet, or you can always talk to people like Mike and Leisha here from DAPS. You can always talk to some people like, I say this because we're about the luckiest people in Dallas, because we've got people like Barb that you can talk to. We've got people like Tammy that you can talk to. We got all these experts in a variety of aspects of care for Parkinson's disease right here in Dallas-Fort Worth, and we're very lucky for that. So if you need more resources, let them know or let me know. But we'll focus a little bit more today on physical therapy than on general exercise concepts, because I've already done a lot of talks on that, and I'm happy to share recordings of those if needed too. Moving on, a quick recap. I've already said it a few times, but why should you exercise? Well, here's a great one. As a physical therapist, I think everything I say and do should be backed by some research, because that way you're not just relying on my opinion or my experience. You're relying on quantitative data from a variety of studies. And there's no greater quality of strength of research than a systematic review or meta-analysis. So those are really powerful because they take studies of other studies. So instead of just saying, here's a research study with 20 or so people, this particular systematic review and meta-analysis looked at 18 different randomized controlled trials for people with Parkinson's disease. And they saw, here's why you should exercise, because aerobic exercise has immediate beneficial effects in motor action, meaning your ability to recruit and use your muscles. Immediate beneficial effects in balance. Doesn't mean your balance problems are cured, but it means they're better when you exercise than when you don't. And immediate beneficial effects in gait, which is our fancy term for walking. So again, that doesn't mean that all walking problems or balance problems or stiffness are immediately completely eradicated, but isn't it nice to know that if you exercise, immediately you feel a little bit better. And if you can build good habits with exercise consistently over time, you can hang on to some of the function you have. In some cases, you can improve the function you have. There's an old saying, which is use it or lose it. And a lot of people say, you know what, maybe with exercise, you can use it and improve it too. And even if you can't improve it in the face of something that wants to take away function, like Parkinson's disease, it sure is nice to be able to use it and maintain quality of life and maintain function or slow the progression of symptoms compared to if you were not active. So that the importance of exercise cannot be overstated. And if you're having trouble finding a kind of exercise you like to do, find somebody like a DAPS instructor, find somebody like a physical therapist, find somebody that has some training and background in helping people with Parkinson's disease to help you figure out what works for you. Because there are an abundance of resources out there. Sometimes it's just a matter of finding the right person to help you through it. Let's move on. Here we see a patient in physical therapy and a PT helping him. And we were wondering, well, who are these physical therapists? I have this slide in here because when I first started running group programs for people with Parkinson's disease, I started hearing a lot of interesting things. I want to show here that physical therapists are highly trained and qualified. And the reason for that is the entry-level degree to practice independently now is a doctorate level. It used to be a master's degree, and now it's a doctorate. And with that, you still can't practice unless you pass a licensing exam, which is unbelievably difficult. A lot of folks will say to new grads who are taking their license exam, you're going to feel like you failed this exam. And if you got through school, you probably are going to pass this exam, but it sure is going to feel like you failed because it's just that hard. And along with the responsibility of a professional license comes a whole lot of oversight, regulation, and standardization, because we want to maintain the quality and sanctity of this profession as physical therapists. So what do I mean by that? I mean, when I used to just do group exercise, or when I did some personal training, or when I was a strength coach to some national champion fighters, I used to be able to say a whole lot of stuff, which was probably helpful. I hope it was helpful. But reality is, if I said something wrong, it didn't really matter because I didn't have anything to lose. As a professional with a license who worked hard to obtain my doctorate, now I have to be very careful about what I say and how I say it, and if it falls within my scope of practice, because if it doesn't, I could risk losing this license. And that's something I worked entirely too hard to do. I would never want to lose it. I love this job. So I say that because when I first started, I had a couple folks in our group classes who were getting advice on their medical care from their yoga teacher, for example. And I love yoga. There are some yoga teachers who are brilliant. There are some yoga teachers who are even medical doctors. But my hope is that everyone can kind of figure out who to turn to based on their expertise, if that makes sense. If you're talking to your yoga teacher for advice, hopefully it's for advice about the practice of yoga. If you're talking to your yoga teacher, hopefully it's not for advice on your medications for Parkinson's disease, because they just might not have the training or background to understand pharmacokinetics or drug interactions or the intensive amount of chemistry that's at play. I also say this because physical therapists, when you think about what's our scope of practice, physical therapists are considered, according to the APTA, the American Physical Therapy Association, to be the movement experts. And that's because in our training, we get an intensive amount of training and experience with biomechanics, with physiology, with anatomy, and through everything we're doing, we're trying to figure out how to optimize movement for a task, with a real goal of helping patients to figure out what types of things can boost their quality of life. Maybe that comes in getting them stronger, but maybe it comes in working on their balance, or working on specific aspects of their walking, or transferring from the bed to the bedpan or the bedside commode, or who knows, because there's so many different areas in which PTs practice. But I want you to know, educated, licensed clinicians who really focus on movement as our key area of practice. Also, that means you probably shouldn't ask a PT, even though they've got some understanding about medicine, you probably shouldn't ask a PT for advice on your medications, because that's not their realm. That's where your medical doctor is going to come into play. Physical therapy is this huge and growing field. I know that when I was switching into the path of becoming a physical therapist, I had been in PT for many years on and off for a variety of sports injuries. I tended to know a lot more about outpatient physical therapy and sports facilities just from my experience as a patient. And then imagine my surprise when I learned, oh my gosh, there are PTs who work in hospitals, who help people in hospitals figure out how they're going to move safely to do activities of daily living when they go home from the hospital or while they're at the hospital, and that can accelerate their rate of healing. There are PTs who do home health care, who drive all over the country to see you in your home. There are even PTs who are contracted by or employed by school districts and nursing homes who are there to help people in those settings too. And there's so many more growing subsets of physical therapists. There's a section of the APTA that focuses on those with neurological disorders. There's a section that focuses on sports. There's a section that focuses on orthopedic injuries. There's a section that focuses on aquatic therapy, doing specific things in a pool to help somebody heal. There's a section, a growing special interest group for patients who are going through cancer treatments. And it's just growing because we're starting to see more and more, wherever you go, movement matters. So here's a rundown. We kind of went through that. One I want to highlight too, just given the world we're in with COVID-19, are those cardiovascular and pulmonary physical therapists. They've been working awfully hard over the last year and a half, along with acute care therapists in hospitals, in COVID wings, to try and get people up and moving safely. There are even folks who work on pelvic floor restoration, pediatrics. I mean, the list goes on. For somebody with Parkinson's disease, you're likely going to see a physical therapist in an outpatient clinic, or if you end up in the hospital, you'll see a PT there. Some folks also get home health physical therapy. And so we'll differentiate those a bit too. Here are some common reasons why people go to physical therapy. And I was talking with a patient just this morning who's kind of a celebrity in the world of Parkinson's disease. And she said, Mike, you're saying to do this annually. She would argue that you should check in with a physical therapist semi-annually, so twice a year. The APTA and the geriatrics section of the APTA have even come up with annual checkup protocols for people to follow, things to investigate on their patients for an annual checkup to make sure you're moving well and you're aging well. So one reason would be an annual tune-up. Another reason would be, as you see for number 2, a recent change in status or symptoms. Sometimes with Parkinson's disease, a change might occur that necessitates a change in your medications. That's not something a PT would work on. However, often with that, if you're having increases in your symptoms, there might be specific things about how you move and specific types of movements or exercises that could be done to help manage those symptoms. I'll give you an example. A great example is number 4 on this list, freezing episodes. Many people with Parkinson's disease, not everybody, but many people with Parkinson's disease experience freezing episodes where if you felt it, you probably have a better way of describing it than I do, but a lot of people have described it to me over the years of, it feels like I'm walking in quicksand. The harder I try to walk, the more it feels like I'm stuck. Or a precursor to that is festinating, where you're trying to walk and all of a sudden you're getting these rapid steps, fluttering feet. Those can be addressed sometimes by medication, sometimes by deep brain stimulation, but always when you're freezing, you should work with a physical therapist as well, because they can help you come up with a plan to figure out how you're going to manage freezing episodes safely. You can see how if you're experiencing festinating or freezing, where you're trying to move, and you can't, and you try to power through, or your feet are moving rapidly, you might be at risk of falling. And there are strategies that have been well researched and well documented for managing freezes that a PT can work on with you. And not all of those strategies work for everyone, but you can dig into a toolbox that you put together with a PT of tools to manage freezes and find a few that really work well for you. So that way, if you're experiencing these symptoms, you can safely manage them, and you can strengthen pathways in your brain to make it easier to use those tools as you move forward. Number 3 is a great reason to see a PT as well. If you're starting to fall, and I know sometimes people say, hey, that wasn't a fall. I just lost my balance a little bit and I recovered it. But if you're starting to experience those losses of balance that were not planned, and I know every now and then somebody trips over something, or you step on a Lego from a kid or a grandkid and you lose a step, that's one thing. But if it happens somewhat regularly, or if it's happened more than once, and you think, gosh, I really can't figure out why that happened, that might be an opportune time to bring a physical therapist into your care team to figure out what specific aspects of your balance are most affected. I say that because, for example, when I take my PT hat off and I wear the hat of a group exercise instructor, I teach Tai Chi, for example, which has really been nicely researched for helping people with Parkinson's disease work on their balance, for helping the general public work on their balance. But also, it's not very specific. And you could say, well, if you do Tai Chi, it's probably going to help your balance. But what will help your balance even more is if you were to go to a physical therapist, because they'll be able to run you through a variety of tests that are based in a lot of well-documented scientific research to figure out which aspects of your balance are most affected. And that way, they can help you come up with a plan to address those balance impairments and get the most bang for your buck out of your limited time exercising. I know not everybody has all day to exercise, or even if they did, they might not want to. I'd love to, but that's not everybody. So it's really helpful to say, wow, for my specific needs for balance, here's what I've got to work on. And that might let you better participate in something like a class that teaches balance training strategies. If you're feeling weak, a PT can test your muscles with a great degree of specificity and figure out which muscles need the most attention. And for functional tasks, which are going to get you the most help by working on them. I put on here boosting balance. We've talked about that. Working on walking applies to everyone as we age. It's not just about freezing or festinating gait that come with Parkinson's disease. Sometimes you just need somebody to analyze your walking mechanics. I can't tell you how many people I've seen at Parkinson groups around town where I think, wow, they're hiking their hip, or they're dragging their feet, or this is someone who could really benefit from PT to make their walking more efficient. And you might say, well, why would I put in all the work for that? To which I'd say, if you're working on the efficiency of your walking, you can help conserve your energy for other tasks. So wouldn't it be nice if you're able to get around during your day using less energy for walking, so you can use more energy towards other things? You might not need to take a nap as much, or if you take a nap, it might be more because you want to, instead of at some point in the day, I'm really starting to fade. And I know a lot of people who could really benefit from that. So fall prevention, working on walking, working on strengthening, coming up with a plan to exercise. These are all reasons a PT could help, but also the more standard reason you think about physical therapy, which is if somebody has an acute flare-up of a chronic episode. Sorry. And what do I mean by that? A lot of people I see, for example, have old injuries. They've got back pain, they've got knee pain, they've got shoulder pain, they've got elbow pain, they've got neck pain. Any of these things, if you're starting to feel a flare up from it and it's getting in the way of how you live your life, a physical therapist can come in and maybe not completely eradicate the pain, but help you do more with less pain, give you some strategies to manage pain, some stretches, some exercises, and some ways to do more. And that's really the name of the game, is working on boosting quality of life. Here's some examples. This is a really wordy slide, which is why I want to make these slides available to you. But some highlights here would be reasons you'd see somebody for physical therapy for orthopedic issues. And by orthopedic, I mean issues with muscles, bones, tendons, ligaments. Rotator cuff injuries are so common. There's a study from a handful of years back that looked at imaging. They did MRI studies on people in their 20s, 30s, 40s, 50s, 60s, 70s, and 80s. And they found a significant percentage of people in their 20s even have partially torn rotator cuffs. They're just asymptomatic, meaning it's not painful yet. But as we age, of course, we're going to have some injuries, some aches and pains to deal with. And that's something a PT can help you with. And a reason to see them would be if you've got something like an injured shoulder, rotator cuff, if you've got something like arthritis in your knees, or if you've got back pain that's really been bothering you, working on that might allow you to better participate in a group exercise program. So the value there is you knock down the pain and boost function so you can get into your group class, and that helps you fight to keep symptoms at bay. So it's kind of like supplementing or augmenting your ability to better benefit from group exercise just by working on some of these little things. And that's also why if you're seeing a PT for something like a shoulder injury or a back injury or knee pain, it might not always feel like a grueling workout. You might not always feel like, man, I just ran a marathon like you do sometimes after a group exercise class. And that's because of the specificity in what they're working on with you. For anyone with a neurological diagnosis, I feel strongly that they should see a physical therapist annually. More and more neurologists and movement disorder specialists are taking a proactive response instead of saying, the old way of thinking was, let's wait. Maybe this was patient driven too. Let's wait until things look bad, then go to a PT. And now we're seeing, well, if you can go to a PT somewhat regularly before you have problems, you can do your best to try to fend off problems from occurring. And PTs get a lot of specific training, even a generalist physical therapist. So even if you were to go to an orthopedic outpatient clinic, somewhere you'd go for a shoulder injury or a back injury, something like that, even they have a lot of training when it comes to helping people work on balance and walking, helping people figure out to some degree how to manage their neurological symptoms. If you're somebody with Parkinson's disease, I sure hope that you're seeing someone with some additional training, but it's not the end of the world if you don't. It's better if you see somebody who has some special credentials like a neurological clinical specialist certification. That means that they've gone through some intensive training on dealing with this wide variety of neurological disorders. You could also say, though, well, does somebody with Parkinson's disease need to see somebody that specializes in all of these neurological disorders? To which I'd say no, because a lot of the movement symptoms or motor impairments that come with Parkinson's disease are quite similar to those of normal aging. They're just more rapid, meaning they come on a little faster than if you were just normally aging without Parkinson's. And they're more pronounced than if you didn't have Parkinson's disease. But still, hopefully you're seeing somebody who's gone through something like the LSVT BIG program. That's probably the most common training program to give people a lot of education on helping patients with Parkinson's disease. Another really good one is the POWER program, Parkinson Wellness Recovery. A great PT who's one of my many heroes named Becky Farley started that program and played a critical role in starting the BIG program. The reason for those is not necessarily so much the exercise selection that's available, but more so that way the clinician that you're seeing can tease out specific aspects of Parkinson's disease that are affecting you, that somebody who doesn't have this kind of training might not notice as easily. And again, worst case, any PT is better than no PT, but if you can find someone who has gone through these training programs, that's helpful. And in the resources section here, I've got a link to the LSVT Global website where you can search for clinicians who have gone through the training in the hopes that that's a helpful resource for you. For seniors in general, we're seeing, the baby boomers are heading into their senior years, and that's a significant portion of the population. There's a member of our group programs here at Tribe Wellness who says something like, "This ain't your grandma's Parkinson's disease," meaning, for example, when I was growing up and my grandmother had an atypical form of Parkinsonism, progressive supranuclear palsy, it's part of why I got into this work, there wasn't as much that was known about how to help somebody with some of these impairments. Now, however, we're seeing that for seniors, for any reason, physical therapy can make a big difference because everyone through the natural course of aging experiences changes to their balance. And that might be vestibular system that's affected, the deep inner ear. That might be vestibulo-ocular, meaning input through your visual system about where your body is in space. There might be sensation changes or sensory changes that impact your balance as well. And a PT can take you through rigorous evaluation to figure out what elements of your balance are most affected. That's one big thing. Another is fall prevention. Another is managing things, issues with your bones, for example, osteoporosis or arthritis. They can help you find strategies to exercise that will hopefully not flare up your arthritis as much. I know one great thing about DAPS group exercise instructors that I hear all the time is they give me a whole lot of modifications so I can participate in the group. And I love that. That's one of the reasons it's so helpful to have group exercise leaders who know Parkinson's disease or know about how to keep going without succumbing to your pain or making your pain worse. A PT then is going to take a slightly different approach and say, okay, let's figure out why you're having pain. Let's figure out the biomechanics involved in this. What part of your motion is flaring this up? Perhaps there's a really tight muscle group involved that we can help you stretch. Maybe there's a really weak muscle group involved that we can help you strengthen. And while we can't undo damage from things like arthritis, we sure can help you to do well despite having arthritis, and in so doing, lessen the impact that arthritis has on your daily life and your activities of daily living. Also for seniors, I know more and more folks are getting joint replacements or having surgeries. It's so helpful after those surgeries for people to have a rest period, right? Where they're recovering. Unless, of course, it's something like a knee replacement or a hip replacement. I can't tell you how many times in my training to become a physical therapist, I'd be in a hospital setting and I'd have to wake somebody up shortly after surgery and say, "Hi, my name's Mike. I'm here with physical therapy. This is going to sound crazy. I know that you just had your hip replaced. And I'm here to help you get up a few hours here after the surgery to put some weight through that leg so we can help that hip to really cement in place and heal well. And people would look at me like, what kind of maniac is this? I just had surgery. So a PT has very specific training to figure out, is this one of those situations where somebody should get up and moving and take on the painful movement directly? Or is this a situation where we should respect the pain, give it time and space to heal? And that's kind of a fine line to walk that can be very tricky. So it's helpful to have the guidance of a physical therapist there. And that's why PTs do so much also in nursing homes and hospitals and inpatient rehab. There are some key considerations for a PT that I want to run through with you. And this is just more to give you an idea of all the different things that are running through our mind. Because I know sometimes people will go to physical therapy and they'll say, wow, I'm here for my shoulder, or I'm here for my balance. Why are you taking me through all of these tests? And the answer is, we've got to factor in all kinds of things to come up with a really good plan for you. So PTs here, first of all, we're trying to figure out what's the injury or the diagnosis or the disease process that's at play here. What stage of healing are we in? Are we in a situation where we need to respect pain? Or for example, like somebody with tendinitis. A lot of times the way to treat tendinitis is to really challenge the tendon in a way that is anything but comfortable. So there are some situations where it's like, ooh, your back pain is a little too high right now for us to do much besides some basic things. Or it might be, hey, despite your pain right now, even though this sounds crazy, I really think we should push forward. So we're trying to figure out tissue healing and time frames. We're trying to figure out, is this something that's going to get better despite our interaction or not? And if not, should we use our time in another way? Maybe to practice things to help you improve your function despite having a problem. And based on all these things, we're trying to figure out, what are some short-term goals for this patient? What are some long-term goals? Based on that, how many times a week do I want to see this person to give them the best help? And how does that match up with objective measurement that we take? I say objective measurement because, in the past, I've done some personal training, I've done some group exercise programs, I've been a strength coach. And in those environments, testing might be, hey, this person looks really winded. Can they run through this number of exercises in this amount of time? And that's how I'll know what success is. But in physical therapy, it's totally different. For example, if we're testing your balance, we might take you through something like the Berg balance exam. And that's a classic series of tasks that we're going to run through, grade your balance during a variety of tasks, and give you an overall score. And those scores are based in a wealth of research to determine your fall risk. Or many of you have done one that PTs, we love to call it the TUG, timed up and go. A lot of physicians, medical doctors call it the get up and go. Both of those tests are essentially the same. If you've been to a movement disorders doctor, you've probably done it, where they say go, you get up from a chair, you walk about 10 feet, you go around a cone, you come back to your chair and you sit down, and they time you. And if you're below a certain amount of time with good quality movement, that tells everybody your risk of falling is very small. And that's based on a wealth of research. Initially, a paper in 1984, and it's only grown since then. But we'll look at these tests to figure out, how do we know if somebody's successful? And also to guide and drive our treatment to make sure we're staying on top of the right things. From all that and the testing, we're going to figure out what type of interventions do we need to do. Is it exercise? Is it maybe something like manual therapy, like a massage or Or is it something like a chiropractor might do, where we're doing some manipulation of joints, cracking your spine or mobilizing your hip? Um, or is it more, we're going to work on some things to help knock down your pain so you can do more? Or, are we going to get more into balance, or getting on and in and out of a chair safely, in and out of a car, on and off the floor? That's what we call transfers. Um, and in addition to all that, we've got to figure out specifically to you, the individual, is there some sort of issue with your injury or post-surgical protocol, or your personal history that says this person should not do the following activities because maybe it places them at undue risk? Or, is this somebody who is going to benefit from what we're doing for a variety of reasons? Like maybe we've got a great plan, but they don't want to do it. Well, that's not very helpful. Maybe we've got a great plan, but they don't understand what the plan is. Hopefully we can communicate it, but if not, it's not as helpful. Or lifestyle factors and resources might impact things. I'll give you an example. I used to do home health physical therapy for a great organization here in town. I visited a guy once who loved to drink Mountain Dew, and he had a 2-liter with him everywhere, which is fine. It's not great. It's not necessarily healthy, but he loved it. He also used 2 crutches to get around because he only had 1 leg. And this is a guy who kept slipping in spilled Mountain Dew. So one of the factors for this guy is to figure out, hey, is there a way we can change your environment so you're not always spilling your Mountain Dew? Because that, even if we help your balance tremendously, it's not going to change the fact that you're slipping on a wet floor all the time. And I know that sounds kind of obvious, but a lot of times factors like this play a big role in determining what our plan of care looks like. The last item here says comorbidities, and that means what else is going on. Usually by the time somebody has Parkinson's disease, since it hits you a little bit later in life, it's not something that you have in your childhood, there are other things to factor in, other injuries, or maybe you have another diagnosis like diabetes or chronic pain or a heart condition. And these are all things that we'll have to factor in too, because let's imagine you have a heart condition. Well, we want to make sure we're not putting your heart in a bad place just to try and work on your strength and balance. So these are all things that we factor in when we come up with a plan for somebody. It's a little bit different than what we do in group exercise. I say we because although I'm a physical therapist, I also run a number of group programs, and I have to think very differently when I run my group programs than when I'm acting as a physical therapist. And again, like I said in the beginning, I can't emphasize enough the value of exercise for everyone with Parkinson's disease. We've talked about some of the physical reasons why, but also it's worth noting, sometimes people with Parkinson's disease, as many of you might know, feel kind of alone. And if you're in a group with people who are going through what you're going through, you don't feel as alone. That's a big deal. And that can change your mood. That can help you do even more in exercise, which can also help your mood. So instead of going in a position where you're in kind of a downward spiral, feeling lonely, doing less, feeling stressed, having more symptoms, perhaps with the group exercise program, you can hang out with your buddies, have a good time, feel good, and keep working towards making progress somewhere. That can be a game changer for people. Also, the stuff that comes up in groups can be incredibly helpful for other aspects of life. Like in our groups, people will share tips. If they're having trouble holding a drink, somebody will say, well, hey, I found this type of cup that has a lid on it and a straw, and it made a big difference for me. Or somebody will say, well, I'm having issues with cramping at night. What do some of you do for cramps? Somebody will say, here's what I do. And it works for me. And somebody will say, I did it and it didn't work for me, and here's why. And this way you can get some more information from people who have experienced what you're going through. That's a very big deal and can make a huge difference. It's not physical therapy, but it can be life-changing. That's part of the reason I love DAPS. That's part of the reason I love our gym here at Tribe Wellness too. I put on here some key considerations for an exercise instructor because I want you to see it's different. A couple slides ago, we looked at all of these medical things and we looked at all of these lifestyle things that go into figuring out how to get somebody to better participate in their activities of daily living and to better participate in things like group exercise. A group exercise instructor has a whole different number of challenges to take on. One of which is they've got to find exercises that are appealing and applicable to the masses. As a PT, I can say to somebody, hey, you need to do this one because it's going to help you with your back pain, and here's why. And if you don't want to do it, I'm so sorry, but you can see how this is helpful, right? And then they'll say, yeah, I can see it, and they'll try it, and they'll hopefully feel better. In a group setting, if you float an exercise out there that people don't like, it's not going to fly. And that's why group exercise instructors need to be very quick on their feet. They need to think of things that apply to everybody, that everybody can do, or that everybody can have an easy modification for. And that way they can try to help you keep your major muscle groups working and healthy. Another thing a group instructor has to do that's very different from the job of a PT is they've got to manage the energy and the tempo of a class. Because if it's not fun, you're not going to go. And if you're not going, you're not going to get anything out of it. Or if you're going, but you're inconsistent, it's going to be a lot harder to find success. So these are factors that are really different than your healthcare and your medical needs. These are, do we have the right music? Do we have the right exercises that give people a sense of having worked hard? Maybe some exercises that are still functional, but that we can work around pain. In group exercise, if somebody's experiencing pain or problems, the general idea should be, how can we work around it to keep you going? Whereas in PT, it's how can we take that issue on, head on, to help you manage it so you can get out there and do more. And in addition to that, there's some overarching themes that I've given lengthy talks about in the past that are keys to success for anyone exercising with Parkinson's disease. One we talked about earlier, aerobic exercise has been linked with slowing the progression of symptoms. And a group instructor has a challenging task of providing an exercise that hopefully gives you a moderate level of intensity, or maybe even a higher degree of intensity, but that isn't going to put you in a place where you're out of commission for the rest of the day. And they've got to be able to keep an eye on you to make sure you're working hard, but you're not overdoing. Also, in addition to that key principle, things like working on flexibility of commonly tight areas, things of working on strength in areas for commonly performed motions. So for example, I love it when those who can perform squats or sit to stand exercises. And if they can't in a group setting, maybe they could have a railing or something to hang on to help them do it anyway. Or if they still can't, maybe there's something else we could do to have them still work their legs a bit. And any group exercise instructor for Parkinson's disease is going to give you some things that'll help with balance, but you should know those are not necessarily the same balance drills. Some of them might be, but they're not necessarily the same as what you'd get in therapy, because like we talked about earlier, in therapy, your plan of care is based on how you show up and what you look like in your testing. That determines everything. Whereas in a group program, we might say, well, we know trying to spend some time standing on one leg is helpful for balance, or slowly weight shifting is helpful for balance, or standing with a narrow stance is helpful for balance. Those are all things that might be more widely applicable than some of the things we might do in physical therapy for balance training. So overall, I just put on here some qualities to look for in a group exercise instructor. Again, with our friends here at DAPS, this isn't something that is as much of a concern, because when you go to a DAPS class, you're usually dealing with instructors who have been around for a while and helped a lot of people with Parkinson's disease. But if you were to go to some community center or some other gym in your neighborhood, my hope is before you work out with somebody, you get a sense of what are their qualifications for exercise, what are their qualifications specific to helping senior citizens or people with Parkinson's disease. I say that because I've heard some stories of personal trainers who do a great job, and I love that, and I want to find more of them. I've heard some stories of personal trainers who maybe are overconfident in their ability to help people with Parkinson's disease because they haven't had a lot of training specific to Parkinson's disease. And so they don't know that they don't know how to help somebody in the best possible ways. And how can you identify that? Because if they don't know or they can't tell you, how can you determine if this person has what you're looking for? Well, one, they might be able to explain to you why they've selected an exercise for you to do using training or scientific research or evidence, as opposed to just relying on a hunch or saying, hey, with some of the other people I worked with, this has helped. Another is you can ask them questions to allow them to demonstrate their expertise. So they can show you if they know about Parkinson's disease. Do they know the major symptoms of Parkinson's disease? Have they worked with other people with Parkinson's disease before? And if so, do they know how to modify an exercise based on what you need? And that's where I'll ask you to be really clear with them to say, hey, here's some pain that I'm having, or here's a problem that I'm having that I really need to work around. Before we look at the summary slide here, I say this not to scare you, but just because, I've run into stories like this. I've got a guy that I've gotten to work with over the last few years quite often. And before I worked with him, he had gone to a personal trainer who did not have experience with Parkinson's disease. I'm not saying this to scare anyone. I'm saying this just to illustrate a key point. This trainer was doing the right thing based on the skill set he had to work with at the time. He saw this gentleman shaking. He thought that this shaking is similar to muscle fatigue. Fasciculation is the term we use when muscles are shaking because they're tired. And using his toolbox, he said to this guy, hey, don't worry that you're shaking. If you work harder, you're going to get stronger and you won't be shaking as much. What he didn't know is that what was shaking was not muscle fatigue. What was shaking is a tremor from Parkinson's disease. What happened is this gentleman worked so hard following this trainer's advice that he pushed himself beyond the effect of his medication working. He pushed himself into an off period with his medication. He stood up because of his off period. He got really lightheaded. He had a blood pressure incident. He fell to the floor, and on the way down sustained another injury. That type of thing could be prevented if whoever he was working with had intense or a depth of knowledge when it comes to Parkinson's disease. So again, I don't say that to scare you. I say that instead to encourage you to get to know who you're working with and why, and to hope that they have some specialty training or experience that can clearly relay to you that they know what they're doing. Just like DAPS instructors can tell you, Barb and Tammy can say to you, hey, here's why we're doing this one. Not only is this a fun exercise, but this is something that is going to challenge your leg strength. Not only is this a fun exercise, but this is something that's going to give you the following things. Somebody who doesn't know Parkinson's disease very well might not be able to provide you with that level of depth of understanding. I know that I've said a lot, and so I've got this table that I put together. Why? Probably because I love tables. Why? Also because I thought this could be a nice resource for somebody where on the left, in the green here, they see physical therapy. In the blue on the right, they see group exercise. In the middle, they see a topic. So we can kind of compare and contrast. And you already know from this talk, if I was to say to you, hey, what's the difference between the role of a group exercise instructor and a physical therapist? You could say a group exercise instructor has the task and the challenge of trying to keep groups active, engaging, and applicable to their population. A physical therapist is working to identify, diagnose, and treat specific impairments to help somebody better participate in activities of daily living. If we were to say, why is somebody, what's the difference between how they select exercises? You could say, well, a group exercise instructor chooses their exercises largely based on some general principles, or perhaps even the theme of a class, which is very common. And that's why it's tough for somebody to say, a lot of times I get this question, what's the best type of exercise for somebody with Parkinson's disease? It's tough to say if it's yoga, if it's dancing, if it's boxing, if it's more about what does this person need? Or since that's still tough to do without a lot of intensive testing, it's easier to say, well, the one you'll do consistently and safely is probably the best one, because that way we at least know you're doing something positive. Whereas we've talked about all the things that go into exercise or treatment selection in physical therapy. Moving on, we talked about outcome measures. We talked about the goal, but overall, when should you go to exercise? Hopefully, if you got Parkinson's disease, you're trying to exercise or do some physical activity every day. When should you go to physical therapy? At least annually. I hope you'll do an evaluation with a physical therapist, or as needed, if you're having an injury, if your balance feels off, if you're starting to fall, if you're starting to have problems with your walking. Where can you go for group exercise? You can go to DAPS groups, you can go to tribe wellness groups, you can go to your community center. Where can you do physical therapy? With any licensed physical therapist. I say that because there's some people who say I'm a physical trainer, or I'm a personal therapist, or I'm a certified whatever therapist. If they're not licensed with, for example, in Texas, the Texas OTPT board, well, they're not a licensed physical therapist. So they might say they have corrective exercise, but they might not be held to the same level of standard of care and quality that a PT would. Why should you do these things? Well, you should do PT to maximize your function in daily living, to manage injuries, to create an activity plan, or to address specific impairments. Why should you do group exercise? Well, first of all, hopefully it's fun. Also, it's affordable. Also, it can prevent your need to go to physical therapy, which is good. It can be a big stress reliever. It can encourage better sleep, and so much more. So in this slideshow, wrapping up here, I've got a whole bunch of resources for you. Choose PT is a new site from the American Physical Therapy Association to help you get a sense as a patient what PT is, why it works, how it works. The APTA has a great site. My clinic has a good site. I'd like it to be a great site. We're working on that. There's some great stuff from the Davis Phinney Foundation, from the Parkinson Foundation. And down here with LSVT Global, you see there's the Find Clinicians. If you're looking for a PT in your area, you can go to the LSVT website and find a certified LSVT physical therapist. I've also got some references on here for your review. If you have any trouble tracking down these research papers and you're interested, you can always let me know and I'll send you a copy. That's what I've got for you for now. I've taken us just beyond the 2 o'clock hour. Hopefully you're still awake. Hopefully this was helpful. And I'll shut up for a moment.
Thank you, Dr. Mike. That was really helpful and it was packed with so much information. So I found myself jotting down notes, making questions, and then I realized that I didn't tell all of our attendees that if you guys have questions, please, we want to encourage questions, comments. You can always use the Q&A feature or the raise hand or even the chat feature. If you had a specific question for Dr. Mike around physical therapy or exercise. I know I just had lots of questions and lots of comments. So while we're waiting on folks to type or raise hand, I'm going to throw a couple of mine out. Can you talk a little bit about what's more beneficial, to exercise for a longer period of time or to exercise more often?
That's a good question. And that's a challenging one to answer. I say that because if you're focused more on the duration of a workout, you could overdo it. And if you overdo it, it's tough to get going with a workout the following day. Mm-hmm. At the same time, though, if you're already physically active, if you already have a good routine, why not try to gradually push things? And you could do that with guidance from a physical therapist. They could help you come up with a plan, but a good general rule to follow if you're trying to bump activity tolerance for a specific activity is a 10% rule. I'll give you an example. If somebody's had an ACL surgery repaired, an ACL repaired through surgery, if they're returning to running, if they've been cleared to return to running, we'll generally say, why not start with one block, running one block, walking a block. If that feels easy, then maybe you go another 10%. So you look at the slabs of concrete and go 10% further and then walk that block. Or, maybe if you're running for 10 minutes and then you get really winded, or you're doing maybe fast-paced walking for 10 minutes and you feel really fatigued. If you're over fatigued, that means maybe you should dial it back to 7 or 8 minutes and see how you feel. If you feel like that's just the end, but I want to start pushing it, you might gradually say, well, I'm going to walk for 11 minutes for each time for a week. If that feels okay, the next week, I'm going to walk for an additional 10% of those 11 minutes. I don't have my calculator with me for the math of the seconds there, but you get the idea. Gradually building up good habits instead of all in.
Absolutely. Yeah. Monitoring where we are and assessing what we're capable of one day versus the next day might change, but that's an important tool in the toolbox. Because I think, as you really pointed out, we are our most important advocates ourselves. So learning and assessing when we need more help or when we might need to consult with the doctor or a physical therapist is such a big piece of the puzzle. So another question just around physical therapy. You talked a lot about the importance of maintaining physical therapy, whether that's once a year, and in some cases you mentioned semi-annually. Do folks always have to get a referral from their primary care physician? Sometimes that's harder to do.
That's a tricky topic. So technically, the answer is different than reality often. So what do I mean by that? Each state has some degree of what we call direct access. And the rules for direct access to physical therapy vary state by state. Currently in Texas, a patient could go to a physical therapist who has a doctorate level of training for up to 2 weeks without a physician referral. At the same time, that still might not happen, and the physical therapist might refuse that patient without the physician referral because Medicare might not cover those visits, or the insurance company might not pay for those visits. What I find, though, is if you've seen your physician within the last 6 months, and usually if you've got a movement disorder, you're seeing your movement disorder specialist or your neurologist every 6 months, sometimes more often. A lot of times you can contact them and ask them to just send a PT referral over. And so that often doesn't require a new visit, which is helpful. I know, for example, UT Southwestern here in town, you can use my chart and you can contact your physician that way. And if they've seen you, they're usually pretty happy that you're interested in doing some PT and taking care of yourself.
Good to know. Good to know. All right. Any other questions or comments for Dr. Mike? All right. Well, looks like we're at a good stopping point. We are so thankful for all the time and research that you put into this. I'm happy again to say that we are recording this. So if for any reason you want to share this with a care partner, or if it's something you want to check out again, it will be on our YouTube channel. So I will make sure that's accessible most likely by tomorrow.
Well, thanks for having me. And hopefully this gets everybody a little bit of a push. I know, especially with the pandemic, a lot of folks that I've seen haven't even realized how much function they've lost until they come into PT and we do some objective measurement. Hopefully this gets everybody even more motivated to work with a PT and get out there and take care of yourselves. Because we all need you healthy and happy, and this is one part of the equation.
Absolutely. Well said. Thanks again, Dr. Mike. Thanks for everybody for joining us.
All right. Have a great day.
You too.